Blog Talk Radio.
Welcome to Women Who Rock Investigates, where branding just got even better for women. Our media source provides case studies in the areas of health, policy and government, human resources, and more. Our experts are handpicked with credible information to validate the latest in these studies. Join us each Tuesday at 10 a.m. Central Standard Time after Women Who Rock with Success. Now, let's go to the show.
Good morning and welcome to our case study podcast where we provide resources and tools from experts that can be able to give you answers to what is going on in the latest in America. So today, of course, we're talking about the COVID-19 pandemic, which continues to cause a lot of Americans to live in fear. Some individuals are afraid as to their children returning back to the classroom as well as to college institutions as well. And so we want to be able to get a grasp as to where we are with the COVID-19 pandemic, and also we want to be able to get a full understanding of what it is. Sometimes we think of a virus as being something that is contagious or what have you, which this one is, but you have to be able to learn what a pandemic actually is and how it can be able to affect you and your household. So on today we have a absolute perfect panel that can be able to provide some of these answers for all of us. So we have returning guest Dr. Chris Colbert, who is an assistant EM residency director, also assistant professor of clinical emergency medicine, and he's the director of health disparities. And so that's our first guest panel. Our second guest panel is Dr. Shapiro, who is a spokesperson for the American Academy of Pediatrics. So he will be sharing with us a little bit further into the show as to how this is affecting our children in the classroom. So last but not least, we have Dr. Bellamuri, if I'm pronouncing that right, and he is also a board-certified internal medicine physician. So good morning, gentlemen, and welcome to the show.
Hey, good morning. Good morning. Thank you for the invitation.
Okay. So we're going to get started. We want to go with first Dr. Colbert. So share with the audience as to what is COVID-19. So you're the one that sees a lot of the firsthand issues of the pandemic because of where you are in the position that you serve in the hospitals and regional trauma centers and what have you. So tell us a little bit about as to what COVID-19 is.
So, great way to start. COVID-19 is a virus. It is one of the coronaviruses, again, that we're very familiar with. This specific strand of coronavirus, COVID-19, has shown to have more of a pathological effect on the community, and we are working very hard every day to identify ways to mitigate the spread of this virus and at the same time identify ways to hopefully have a vaccine as well to both protect our patients, protect our staff, and protect our community.
So what is some of the issues that you see on a day-to-day basis? We know that the COVID-19 has risen in several states. I think Texas, according to the latest breaking news, Texas and Florida are the hot spots for COVID-19. And so in the Chicago area, what are you seeing there as to how people are coping with it as well as to the rise and spike in COVID-19?
So here's the thing. We are seeing a modest increase in the diagnosis of COVID. As you are very correct, it is both identified in Arizona, Florida, and Texas. These are states where there's a noted increase as well. Both Chicago and New York had their biggest hits at this time in mid to early March. The effects of COVID expand in many different directions, which is what we see very commonly in the emergency room, from aspects of I'm concerned if I expose my family, or I don't have symptoms but I'm positive when I was tested, what do I do? There are a lot of aspects of COVID that require specific and tailored answers. And it depends on the presentation of the patient and what their concerns are, and in which we try to address, again, providing some safety for the community and for staff as well.
Absolutely. Okay, thank you. Great response. So, Dr. Shapiro, next to you, you know, the president of the United States, President Donald Trump, he's on the verge right now of terminating Dr. Fauci, I think if I'm pronouncing his name correct, of some I guess inadequate statements that he has made as to not reopening America in a lot of areas. Perhaps maybe they're trying to go back to phase 1 for everyone. I know a lot of areas have mandated for individuals to have on the mask and what have you. I know in our local jurisdiction here in the county, everybody has to have on mask. So with that being said, what are some of the risks for the educational side of it for the children returning back to the classroom?
Well, first of all, thank you for the invitation, and we need to understand that I'm a father and a pediatrician, and of course I want my kids to be at school. I think that we all understand that this is actually a place that could be safe for them, socially, dynamically, movement, everything that you can imagine. Especially there's a lot of communities, the Hispanic community, the African American community, that actually depends a lot on the food that they get on the weekdays. So that's the safe, secure way that they get, the nutritional value that they need. And right now they do not have that part. And a lot of these places actually are the secure part where adults is taking care of them. Then there's a lot of things there that we need to take to account. But the most important thing, and what the American Academy of Pediatrics is saying and sharing, is that we need to have a safe place for our kids. And not only for our kids, for our teachers, for our parents, and our extended family. We have had a lot of experiences with other parts of the world, South Korea, Iran, and even in Europe. But on reality, we need to be very, very acutely aware of what's happening right now. Everything is going up. We need to defend ourselves. We need to protect ourselves. And we understand that the best part that we know about this virus is until we get a vaccine or a real medication that actually can protect us, we need to start doing and continue to do the 3 things that no matter what activity we do, we need to measure everything through this. The first one is social distancing. The virus goes from one person to another person. If we are far away from each other, it sounds horrible and it's a pain in my heart, but if we are far away from each other, it's very hard for the virus to jump from one side to another. And it uses our body as the machine to create more viruses, and that way we can actually cut the spread of the virus. The second thing is creating a barrier, and we have heard a lot of the mask. And at the beginning, we understood that the kids actually need to wear one. And of course, kids less than 2 years of age, we are not recommending to have one. Above that, we can actually train them to do it. And of course, a lot of the doctors, and we have heard a lot of the things that, this is uncomfortable, it makes me feel weird, but in reality, there are certain side effects. But in reality, if we go back to history and we put all the surgeons and doctors that have been using them for decades instead of hospitals for hours in surgeries, we know that there's really no side effect that above like having some skin irritation and some nasal congestion. Then that's something that our kids can use. Of course, we can, as parents and as a society, we actually make it positive for them to wear a mask, play with the kids, play with the adults, and have a mask. That's a way to actually make it a little bit easier for them to understand that it's something that it's completely not natural for us. In other Asian communities in the world, they have been using that with SARS and with MERS and other type of infections, even with the H1N1 pandemic in 2009. Then right now, we have a choice to do something, and we need to follow the 3 rules: social distancing, the mask, and actually washing our hands in order to protect our communities in order to open the schools. And we need to have the same conversation with school teachers, because there's a lot of school teachers that are on the high-risk level. And the same thing with the parents and grandparents around the kids. And, it's a very local decision that needs to involve pediatricians, parents, and teachers in order to make the best decision.
So do you even feel that when the students return back to the classroom, because a lot of parents have opt out of the classroom and decide to educate their children at home, so do you see that there will be a lot of distractions in the classroom as far as take for example, I think I went to the salon, and when I went to the salon the other day, that's all I saw. I saw more spraying and wiping down than they did as to catering to the customers. So do you see that will be a little distraction in the classroom, having the teacher have to be able to wipe down certain desktops and areas and what have you while she is trying to train and teach in the classroom?
It will be something new, Diane. It will be something new. It's not something that we're used to. It's something that it's going to be hard for all of us. And I would love to give you a straightforward answer, but the important thing is that we are all experts on this. There's nobody that has done this before, and we all need to try to be flexible with this, taking account that security and the health of our community is the first thing that we need to be measuring.
Okay, great response. Okay, so Dr. Sarma, good morning and welcome to the show. I think this is your first time as well on the broadcast. So in regards to the practice that you have in internal medicine, as Dr. Ion had just mentioned to us, social distancing is very, very important. In society, we have to practice social distancing. So in your practice, how effective can that be as far as in the office, in the doctor's office, for the doctor visits? People are coming unglued when you get too close to them. It does not matter where you are, whether it's the restaurant or whether you're standing in line at Walmart or whether you're trying to pay for your bill. People are coming very, very unglued. As we see, or as we saw last week on Inside Edition, on some of their news reports, people are fighting. You cough, you push, you get punched. So in your practice, how are you seeing individuals practicing social distancing and the effects of it?
Hi, Diane. Thanks for inviting me. So it's a good question about social distancing. With respect to my practice, I run a software company now. My background is I used to do inpatient-only internal medicine in the hospital. 80% of my work was transplant medicine, so heart, lung, liver transplant. And the reason today I run a software company is about 6 years ago, my friend's daughter ended up in my ICU and died of an infection. And after I got done telling my friend his daughter died, I went home. It was the worst day of my life, mortgaged my house and started a software company to better identify infections faster. And so that's what we've been doing in hospitals for 5 years now. And when COVID hit, we essentially started helping the community with COVID response using software. So to kind of answer your question on how my practice is dealing with social distancing, don't have one anymore.
Okay. Okay. So Dr. Colbert, back to you in regards to on a regional aspect. I know that you deal with a huge variety of patients, or I guess I would not say patients. I guess I would say nurses and we can say patients. In what you see on a day-to-day basis, are you all requiring masks when they come into the ER or they come in to get checked in for a medical procedure on a day-to-day basis, or what have you? Are you seeing more where they are implementing the mask as a mandate?
Yes. First of all, I want to say that I agree with the statements of my colleagues that really highlighted the importance of social distancing, wearing a mask, and washing your hands, that significantly decreases the risk of transmission. And I think it's extremely important that we realize that our realistic goal is to mitigate transmission, not eliminate. And that's realistic. What we do in all hospitals across the nation, if you're walking to an emergency room, you're required to wear a mask. All of our staff has worn a mask, and you are required, and anyone required that comes in the hospital wears a mask, because walking into a hospital exposes you to viruses that are existent. And I think it's just a good policy. It's something that we do. And because of this as well, we do not allow visitors for families who are admitted to the floor, just because this concept of exposure and contact. Exposure and contact are the largest factors for the transmission of a virus. So if we can decrease that, that will have a significant effect on the community and patient outcome. So yes, in fact, most ERs if you walk to an ER, everyone's wearing a mask, and it's a policy to wear a mask as well.
Okay, so now still with you, Dr. Colbert, there has been some questions or some statements that arose, of course, previously around February or something like that, when the virus was in its premature stage. It was not mature yet. Right now, it's very mature, but it was like in a premature stage to Americans in the month of February. So it was predicted then that when it gets warmer, the virus would get better, because everyone thought that because of the cold temperatures that it would cause the virus to even get worse. But when it got warmer, it's supposed to have gotten better. So what do you say to that? Because that's not because that theory is not true. That is a false hypothesis. And so today we see that it has increased. And I know it's because people are going out to the beaches and they're not practicing social distancing. But I guess Americans were thinking of the theory of what was stated, that when it got warmer, that we would see a decrease in the virus. So how can we determine what will cause the virus to decrease? We know it's the washing of the hands. We know it's the social distancing, but sometimes people become confused because we don't know what to believe, because we're hearing so many theories and hypotheses from different scientists, from different physicians, and from different medical health centers, that sometimes the Americans can become confused and disoriented as to what to believe.
And here's the thing. I can understand how someone can be confused about this, because you're hearing information from so many different resources, and reliable resources as well. And so when patients present to the emergency room, or just basic discussion with neighbors or friends, there's a lot of clearing the air that is required. By definition, a pandemic has to travel different continents. That's the difference between pandemic and epidemic and just a regular flu season. So there are reasons why we define this as a pandemic, the reasons why we define things as epidemics. And if you can think of the original conversation of the coronavirus, it was a reference to other countries who had warmer climates. So it's my hope that from this entire event that we make informed decisions and conversation in reference to a virus transmission has to do with exposure and contact. And though there is some direct relationship between weather, there is fundamentally, it's the contact and exposure that we need to address to decrease transmission. So yes, you can get viruses in the summertime. You can't get them in July. You can't get them in October. And it's a false misunderstanding that because it's warmer outside that you decrease transmission of a virus. Okay, so Dr. Shapiro, back to you. So in regards to your profession is in pediatrics, and so they are testing a couple of vaccines according to the latest news reports. You know, we see different things, just like we just discussed after Dr. Colbert providing the resources and his response. So we see that they are working on a couple of vaccines. So take, for instance, if
individuals come to your practice in the areas of pediatrics or in the field that you are in, will that be something that you would consider to your staff as to implement for children?
It's an amazing question. The things that we need to consider at the moment that we have the vaccine is a couple of things. The first one is that when we actually give the vaccine, it's completely different than giving a regular medication or a regular treatment. Usually when you get a medication or a treatment, you already have diabetes, you already have high blood pressure, you already have a problem, and there's inherent side effects of that medication. But, you kind of chew them up because you want to control the sugar or you want to control the blood pressure. But with vaccine, it's completely different. We need to make sure that we are giving it and it's safe because we're giving it to people that are healthy, and we want to protect them and not give them actually that shield against the COVID-19. Then having that as a baseline, the important thing that we need when we have the vaccine, then probably will be like a couple of vaccines, 4 or 5 from the 130 plus that we have out there. We need to make sure that these 3 things are aligned with our patients. I believe that vaccines have changed the way that we perceive the world and has protected us and actually saved millions of lives in the past, decades. Then I think that this will be an amazing tool to go back to the normal way that we do everything. We are very blessed that the technology is different, that the way that they're constructing this type of vaccines is completely different from the vaccine that we had before, because that way they are actually doing it faster. And we already have a lot of legwork done because of other coronaviruses that we saw before. Like SARS and MERS, and they were trying to do a vaccine. Then we knew kind of the structure in general terms of different type of coronaviruses. And we already have the technology, we have artificial intelligence, and it's extremely important right now that, if we have it, we need to measure those three factors.
Okay, that's fair enough. Dr. Sharma, back when they had the Ebola pandemic, well, it really wasn't a pandemic. I guess it was just a virus. So people wasn't really just, as serious about, that illness as they are today. So why do we see less people going to the, regular clinics to be able to get tested? Because I know in our location, once they released with the health department clinics that you can come in and get a free testing, it was no one on the parking lot. And so I'm trying to wrap my thoughts around as to why people would not be willing to go and get a free testing, free of charge, but they want to still not practice social distancing. What would be the fear as to that in your terms that you feel that people would not want to go and get tested?
That's a great question, Diane, and it's very interesting that you bring up Ebola. Because 2 reasons. One is I was, for better or for worse, in the eastern part of Congo in 2007 when they had a small Ebola outbreak that was pretty self-contained. And you kind of sit there in fear, afraid that the next person who walks in the door with blood streaming down their face will infect you or the people you work with. And then fast forward, 10 years or 12 years or however, long that was. I think it was about 10 years before we had this most recent scare of Ebola coming. And I remember, in our hospital, we had, a section of the ER quarantined off for, people who traveled to West Africa and had came in with fevers or complaints that seemed like Ebola. And even then, like I saw some, I also got to visit a few other hospitals, and it seemed to be this heightened awareness for an illness that's not as spread as COVID is now. And so to be honest with you, I think people are just burnt out and tired. They've been sitting at home for so long, and we're not made to sit at home. We're made to be in community. We're made to be productive and be out there, in society. So I think one reason why people are not taking social distancing seriously is possibly they're just tired of it. They're just tired of living in a room that's artificial a little bit to them. The other reason I think people are afraid of testing is we've seen numerous cases where people have all the symptoms of COVID, right? They have, let's take an example. We had a gentleman who had tested positive on our system for employers. He had a fever and he had a headache and he had loss of taste and smell and all of the stuff that is pretty classic nowadays for COVID symptoms. He had a runny nose and he developed a cough a few days later. So his employer sent him for testing and the first test came back negative, saying he does not have COVID. Mm-hmm. And everybody said, well, that's kind of hard to believe. So thankfully, he decided to stay away from work. And then the second test came back negative. And, he kept getting worse. He kept, his cough got worse. His wife bought him an oxygen testing machine from the CVS that you put on your finger. And his oxygen numbers began getting worse. And so finally the physician says, I don't believe the PCR test. Like, I believe, what we call now is syndromic surveillance data, which is tracking a person's symptoms in time. And they decided to treat him, give him steroids. And the guy, 2 days later is back walking his dog. And he didn't bounce back to 100%. But so I think a little bit about PCR testing is, it's like beauty is in the eye of the beholder, right? And so PCR testing is accurate depending on who's doing it. Later we found out that this testing site was using Q-tips instead of using the full swab that you want to get the sample from the back of the pharynx or back of the throat. And no wonder they were not getting their test results back accurately. So I think a little bit of fatigue, why people are not social distancing, they're just sick of it, I think. I know I'm tired of quarantine and being careful. Of course, I understand the seriousness of it. We always mask and sort of, be careful when we're outside. But I think people are tired, and I think we want this thing to be over. And I hate being pessimistic about the future and talking about gloom and doom, but we're not out of this yet. I think we have another 18, 24 months to go on this marathon.
If I may, Diane, can I interject?
Go ahead.
Now,
sure, go ahead.
I agree with my colleagues, and as an emergency room physician, and as someone who sees people that walk in the door each and every day since early March, a reference to COVID, is that we're all tired, and I understand that. I understand that, and it's very human to communicate that, but our numbers have bumped. There are no ICU beds available in Texas. They're running out of ICU beds in Florida and in Arizona. And the reason I'm saying this is because it's my experience that no one takes it seriously until it affects their family members. No one takes it seriously until it affects their mother, their cousins, their children. Or I get the family that comes in and says, you know what, my son looks great. He tested positive for COVID. He's 14 years old, and but I have my mother who lives with me at home. Or, and I think it's important that we just go the distance. We are a country that perseveres, and this is one of those times where we have to just take a deep breath with a mask on and realize that this is something that I think is just so well said that this is not going to turn over. This isn't a virus we can swipe right or swipe left because we don't like it. And you can't grow tired of a virus and not practice the three basic ideals of social distancing, washing hands, and then wearing a mask, and then the next week bring your mother into the emergency room. You have to make a decision on commitment.
You know what, Dr. Colbert, and I think that my colleagues are sensing something very interesting that I'm hearing a lot, that a lot of people just feel that because they are not seeing it, or nobody around them has been sick, or nobody has been very, very harmed by the virus, it doesn't exist. And that's one of the most painful thoughts that I have. And
It's like saying, well, I do not believe in cancer, and that's why I'm smoking because I have never seen it. Then it breaks absolutely everything that we know about public health and the way that we protect each other. Then, I completely agree that we need to have that conversation of prevention and on reality. And I really do not think that we need to suffer in order to learn. And I don't think, if all of us can actually unite and deal with the same comments and do the prevention part, I think that we can improve the whole thing that we're living right now.
I give a comment to patients that come into the emergency room, and they'll come in for flu-like symptoms. Now, mind you, it's July, shortly becoming August, and I always ask, specifically individuals that are passionate not to wear a mask in a hospital, when is the last time you've ever been concerned about a virus during the summer? When have you ever had to worry about a virus of this proportion during the summer? And then my comment is, I understand the reservation to wearing a mask for whatever reason. I get that. We can engage in that conversation. As a physician, it's our role, everyone that's on this panel who really, we're all saying the same thing, is to provide information so that someone can make an informed decision. And my comment would be, last year, let's just say last year, if you were to walk into a 7-Eleven, there's a sign on the door that reads, no shirt, no shoes, no service. That's not a CDC guideline. That's not a guideline by your state. It's 7-Eleven that said if you don't have a shirt on or socks in some capacity, something covering your feet, you cannot buy a Slurpee and Doritos. And no one bucked the system. They just went into the store and put on their shoes and kept on their shirt. And if someone asked you to leave because you didn't have a shirt on, they would leave and return to buy their bag of Doritos. I don't understand why it's a big ask during a pandemic to ask people to wear a mask to decrease viral transmission.
Absolutely.
Yeah, I totally agree. And Diane, anecdotally on this, this thing we brought up about people's fatigue. What we've seen, we work with a lot of employers making sure that their employees come to work safely and that no one who comes to work has, number one, been in contact with someone who has COVID and has not been tested. Number two, that they don't have any symptoms of COVID. And number three, that, when they're at work, they're able to implement these best practices like masking. And, you mentioned taking a heightened state of cleaning the fomites or the surfaces where viruses can live. And it's really interesting to see people who normally would not be compliant. Once you kind of educate them, and, I've seen this happen successfully at employment places where, the employer is taking the initiative to say, look, like everybody, we want you to be productive and we want you to be able to make a living and feed your family and we want you to be able to come to work. And here's some rules that we need to have in place so that everybody is safe. Because if 50 people get taken out of the workforce because they get infected at work, we have a huge problem on our hands. Like we're going home, we're infecting our community, we're putting our coworkers at risk. And it seems that, a more clear messaging that takes place at the work site for those of us who are fortunate enough to continue to go to work, that seems to be like a thing that needs to be done consistently and across the board. And I don't know if my colleagues, for example, in the emergency rooms, like hospitals do a great job of this. They do a great job of, educating their staff on, not just the medical staff, but all the ancillary staff, the people who are providing the meals, the people who are working in the kitchen, the environmental services group. We work together as a team, in a hospital. We consider each other as an extension of our family just at work. And I think if you bring that attitude with you to wherever you're going, whether it goes to the store and whatever that is, I think it requires somewhat of a shift in thinking about how we think about each other. And I think if you start considering, the other person as a member of your extended sort of social circle / family, the conversation changes. It changes from, you can't tell me what to do, to, let me help us be safer as a society and kind of lead the charge, globally on the response to this thing.
Absolutely.
I cannot have said
Absolutely
that any better. That is
okay.
exactly
Chris, hold on for a second. This is for you. Hold that thought right quick, because I want to be able to get to. This is after you respond. Okay. The next question is going to be for you as the flip side of COVID. After you get through responding to the previous guest, after you get through responding to that, the next question will be for you. Is what Dr. Sommer had brought out as to, people can come in and we think just because we take their temperature and they have a fever, we assume that they have COVID. And so we want to be able to discuss the pros and cons of that too, as to how the numbers, they appear to be spiking, but sometimes individuals are accused of having COVID and they don't have it just because they have a running nose. Sometimes some of the symptoms of COVID is just like a person that has the flu or they have a natural cold. So I would like for you to address that after you address the comment that was just made.
Oh, I was just saying amen to that comment that was made. That was just so spot on. And I think that the conversation from the panelists that we have this morning, these are the physicians that you want to, just from listening to the other physicians that are on your panel, these are physicians that you would want to see your family members, the ones that are advocates for people's health, who can sit down and have a conversation and say, let's make an informed decision and move in a place where not only do your family members feel better, but you feel better as well. All of this is we're and I think about this because as an emergency room physician, I see everybody, old, young, black, white, like everyone that walks in the door, we see, and there is no. The only thing I have to do is just wait to be seen. And so I have discussions like this from 1 o'clock in the morning to 1 p.m. and with all walks of life, all educational backgrounds, all individuals. So I get it. It's just you want to be able to empathize with your patients and also provide information. And you don't want your patients to feel as if they're being talked to, but we're having a discussion and sharing in your health. And in reference to the question you asked, what about the individuals that come to the emergency room with the sniffles and they don't have COVID? I say you don't have COVID. However, we have to be cognizant that this is a dynamic process, that all tests are not 100%, and you have to err on the side of caution. And my analogy is patients come to the emergency room all the time with chest pain, and we do a cardiac workup on those patients. And statistically, 50% of those patients will not have any cardiac origin. They're not having a heart attack. They're not having any other concerns. But we're going to work you up because that is the standard of care and what you want. And once we identify or the labs come back or the values come back, then we need to have a discussion. So what do I do from here? Doctor, I have chest pain, but it's not my heart. So where is it coming from? Doctor, I have a runny nose and I've lost my sense of smell and I have a little bit of a fever. It doesn't sound like COVID right now or the test is negative right now, but what do I do? And that's where the bedside conversation with your patient and what they do and where we are and what we anticipate on doing with medical management comes into play. Having this conversation where I have these symptoms, but I tested negative is different for a school teacher, which is different from a 15-year-old who's at home with their family, which is different than someone who works at a nursing facility. Like all of those variables are so important in the management of these individuals, and it's tailoring their management to what they do and where they're going, and standing and working with standard of care as well. So it's not one box fits all. It's from this box where you're using this resource of information, and we're going to tailor this information and conversation to you.
Powerful, very powerful, and thank you so much for that, Dr. Shapiro. This question is for you. We're going to talk about, we're talking about both sides of it, of the COVID-19, and so we're going to get to the part of regarding the mask. People are making masks out of everything, out of scarves, stocking caps, home remedies that they have at the house, and then you have people that are in a confusion and a combustion as to which a mask is appropriate to wear and how effective it is. Of course, in articles that we have seen on CNN, Washington Post, Inside Edition, people have spent hundreds of dollars in a mask trying to prove which one is the best. So what are some of the myths that we can talk about, Dr. Shapiro, in regards to which mask is the best? I saw somebody make a sock out of a mask and put it straight over their child. What are the benefits and how are we really protected through these masks?
Diane, I'm going to be completely truthful. The best mask is the one that goes covering your nose and your mouth. That's the best one. From that, let me walk you through what actually happened and how everything came to be right now where we are. In all in America, and including Canada, Mexico, U.S., and all Latin America, we're not used to using masks. Masks are, like united with the idea of going to the hospital, being sick, and, when you see a mask, you actually have that weird feeling in your stomach that something is wrong, and you just don't want to use it. In Asia, Singapore, China, Japan, and other countries on the area, they have had a couple of scares before, from pollution to actually SARS, and one of the things that they have used to mitigate the spread of the virus and actually kind of protect each other has been actually wearing the mask. Then that's kind of the basis of the psychological part of where we start having issues right now. We started hearing a lot of messaging at the beginning that, wear a mask, but it's not necessary. And after that, we suddenly switched to, we actually need the mask. And why did that happen? Well, on reality, because we needed to break the cultural realm of that. That's one. And the other one was that we have more information regarding what happens when you actually wear a mask. And a lot of the times I'm wearing the mask to protect myself. On reality, the basis of the mask is actually to protect everybody else. And they are using it. Diane, when you use it, you're protecting me. And when I use it, I'm protecting you too. Then all of us, the four of us, we're protecting each other when we're using the mask. And of course, it creates a barrier between us and our saliva and our mucousy stuff. When we talk, we have like little things that go flying all over, and we want to limit that part. And of course, there's certain type of barriers that when you have other people talking to you, you have that barrier that helps. And that's one of the most important. And we need to understand that, for example, a lot of people start buying the N95. Those are like kind of the best disposable ones that we have out there. The problem is that, and the doctors can vouch for this, it takes 20 minutes to actually have a test of an N95 mask to see if it works or not with someone that actually knows how to do that test. Then if you're buying it from Amazon or anywhere else, it's still, most probably it doesn't fit your face. Then that one, I am going to discard it completely from the conversation. The next best one would be kind of the surgical mask. This one actually works. But the idea right now, and at the beginning we were, not dismissing that one, but we're recommending that one to be actually at the hospitals because that actually creates a better barrier for the physicians and technicians and nurses and everybody else that is taking care of people that are sick in the clinics and hospitals. And that's why we needed that one. And to answer your question regarding if we are making it from cloth or T-shirts or bandanas or something like that, the concept right now, and we are seeing this more constantly with a lot of new research papers, is that we need to have a barrier. That's the most basic thing that we have. Then if you have a cloth in front of you that you're making at home, that's very effective. A lot of people are buying the ones that have like the bulb, and they feel that there's like better air circulation. I need to remind everybody that if there's air coming in and out, that actually defies the purpose.
that actually means that, or you're giving the virus or your spit or your mucus particles, or someone else is giving it back to you because you're having fresh air. Then, it's very important to continue using it. The more we use it, the better it will be. And, the minimal side effect that we have, it's more like the things that we were talking before, it's more on the skin part, a little bit of nasal congestion, but that's about it. If not, Diane, a lot of our surgeons will be very, very sick, or people that have been using them for decades in the hospital. They will be very, very sick with their lungs and stuff like that. And that's something that we can actually use, protect. And in the message is wear a mask. And if it's a cloth mask, use it. And you do not need to, to pay like hundreds of dollars for a mask in order to protect yourself or your family.
Absolutely. Absolutely. So with that being said, Dr. Sarma, this question is for you. We're still discussing about the mask and the conflicts that individuals have in regarding to what they wear, and we're going to go a little deeper with the material, because sometimes individuals feel that when they have the mask on, they feel that it's not being supportive, which I don't know where they get that theory from, simply because they feel that they're breathing it back in. So with the little device that they have on the mask where they're, like what Dr. Shapiro was stating about, breathing it out, they feel that they're breathing the germs right back out, with the little, I don't know what it is that they have on there, but people are spending a lot of money. And so what the podcast is here today to show the listeners is to how to relax but still be able to maintain this social distancing. So how important is for us the material, because people are concerned about the zinc. Sometimes people are, they're saying that the type of fabric that they have, and they're breathing it back into them as ingestion to them, and it's causing them to be sicker or what have you. We're just having so many theories, but people does not have the medical facts to back what they're stating. So how do you feel about that?
Yeah, a good question, Diane. So full disclaimer, I am firmly in the wear your mask camp, mostly because of my, like everybody else on this call, 12 years or 13 years of all you're doing is learning medicine, and all you're doing is, sharpening the axe to go help people. Anyone who comes to me and says that, they cannot wear a mask for any reason, they have an uphill battle, number one. Number two, with respect to rebreathing, their own germs, I mean, your skin, like your oral mucosa, your mouth, I mean, that's just filled with bacteria. I mean, if brushing your teeth doesn't do anything except for move the bacteria from one place to the other on your teeth. And just the sheer volume of bacteria that you have in your mouth, there's no amount of rebreathing with your own air that can hurt you, especially unless you're on a you're in like a closed container where the amount of oxygen is gradually falling within the container that you're in, which wearing a mask is not. Right. So wearing a mask there isn't a single study out there that shows that people who wear masks do worse than people who don't wear masks. I can show you a few the other way around, which talk about people who don't wear masks and their risk of infection being higher. That's number one. Number two, with respect to people being concerned about inhaling stuff that goes into their lungs. There are occupational lung diseases for people who work in grain silos or people who work with sandblasting. But you need to understand that in order for someone to get lung damage, the size of the particle going into their airway has to be smaller than 7 micrometers, right? So that's really, really, really small. It's as small as a red blood cell. Most of these fibers that people are inhaling, they deposit in your nose. And that's not to gross people out on the podcast, but that's what nasal mucosa does. It catches all of this stuff that's floating around in the air, and when you sneeze it out, that's why it looks horrible. It's because all the stuff you're inhaling deposits in your upper airways, and it just comes right out. And I think that, with the advent of sort of non-peer-reviewed literature, which is just blossoming on the internet, people will search for their point of view and try to prove themselves right by reading a few things online. But one of my colleagues on the line today mentioned, you want to wear a mask, and then you bring your elderly mother into the emergency room and you ask for help. And we're going to help you. That's just the sort of people who work in emergency rooms and in hospitals. They'll help you no matter what. And we are helping you to the risk of our own lives and to the risk of our own well-beings and the well-beings of the people who are around us. So it's a really interesting question. It's who are you going to listen to? Are you going to listen to the people who put their lives on the line pretty much every day, especially in the middle of this pandemic, for your sake? Or are you going to listen to someone who's kind of sitting in the comfort of their living room, feet up on the table, watching Netflix while they type out a article on why they think masks are bad? And it's and that's to the end of the not to belittle people who are, I love to sit on my couch and keep my legs up and watch Netflix and write opinion articles all day, but ultimately it comes down to that. It's look at what people are doing, look at their actions, and look at what they stand for. And, that's, you can pick whose camp you want to be in. I'm going to be on the side of the guys who are actually able to save a life when it comes down to it. That's the people I want to listen to.
Okay. So this last question is for Dr. Colbert, and this is probably going to wrap it up, and then I'm going to let everyone be able to share how the audience can be able to connect with them. We got about a few more minutes left, and so Dr. Colbert, in regards to the social distancing, of course, we see individuals that are on the beach. They have the pads, I guess you want to say, where they have circles where they are 6 feet apart. So are you still continuing to see a spike in a rise in people coming to the facility in regards to that, even though they're practicing it on the beach as well?
Again, we want to mitigate. This is wearing a mask, washing hands, as well as social distancing. It's going to decrease the transmission, and that's what we want. And as my colleagues have said on this panel, is that it's unrealistic to expect everyone to live in their basement for the next 2 years, waiting for this virus to truly go away. And so the question is, what can we do to keep our community mentally healthy, our families mentally healthy, as well as decrease the transmission of this virus? And so as long as you're practicing social distancing, it's a bit much to expect someone to truly practice social distancing in a pool of 50 people. However, my humble advice as a physician is to practice social distancing. So having those designated spaces on a beach honestly has an effect. Decreasing the amount of people in a pool, in a community pool, honestly has an effect. Wearing a mask statistically has an effect. And so just as my colleagues, I'm a true advocate for people's health and a true advocate of social distancing, wearing a mask, as well as washing your hands.
Okay, absolutely. So we're going to go around the panel, and we're going to let each individual be able to share any, social media platforms that the audience can be able to follow them in future reference in regards to their practice, or if there are any the books that you have written, you can be able to also share that at this time. So we're going to start with Dr. Shapiro, and he can go first.
Well, thank you so much for this. I'm open for any discussion, and it is actually important to have this
this reaction, because right now in diversity lays the key of what we need to do right now and to continue having a conversation. You can find me in Instagram or Twitter at dr_shaps. That's dr_shaps. That's SHAPS. Then dr_shaps. Or the website drshaps.com. And I am very, very happy to have this conversation with my colleagues, and it has been very, very refreshing to have this conversation at this time of the week.
Absolutely, because I was thinking the same thing of what you were thinking. I said, well, I think this panel may need to come back on real soon so we can continue to be able to address this as individuals and are at home, and then also where they can be able to have the resources and tools that they need. So you all will be hearing back from me real soon. So go ahead, Dr. Sarma.
Thank you, Diane. Very grateful for you to have us on. It's honored to be on a panel with people who are smarter than me. And so you can find me on Twitter at Sarma_Valamuri. That's SARMA_VELAMURI. Alternatively, you can just go to stopsepsisnow.com. And you can find me there. You can message me on it. You can email. My mission and passion is to stop the number one cause of death in hospitals, which is sepsis. And now we're privileged to be able to work with schools to stop COVID. And really, really appreciate you having us on. Thank you.
You're welcome. Oh, you're welcome. So go ahead, Dr. Colbert.
As always, Diane, this is a tremendous resource you're offering to the community. So first and foremost, thank you for this. It speaks to your character that you're offering this and have the foresight to say, hey, this is something that needs to be addressed, and pull these wonderful physicians together to have this discussion and expand this conversation. So thank you for that. Thank you, fellow colleagues on the panel. Again, my name is Christopher Colbert. I give lectures at different institutions monthly. On Twitter and on Instagram. It's Dr. Chris, so DRCHRIS .ER. So that's my Instagram. Again, it's drchris.er. And then Dr. Chris ER with no dot is my Twitter. So please feel free to connect and reach out if you have any questions at all, and hopefully I can provide some insight and we can expand the conversation and everybody lives a healthier life. Thank you.
Great. So thank everyone for, once again for being a guest on the show on today. And, of course, you will be the same panel that will be returning back probably in about a week or so we can be able to continue to follow up on this and be able to give some insight to Americans as to how this can be a pro and a con to them. So until next time, you be encouraged. Thanks, everyone.
Thank you.